Heyo, Dr. Nader Amer with DNA Physical Therapy. Today we're talking about how to use a massage gun. Don't forget to book an appointment at dnaphysicaltherapy.com. So let's begin. We're going to familiarize ourselves with the unit. This is the unit. This is where all the power comes from. The power button has different lights for different levels of intensity. This is the charger at the bottom, usual USB charger. Charges up to 30 minutes. 30 minutes is like the minimum. 3 hours is usually the full complete charge. It also comes with 5 attachments. It comes in this sweet, neat little package for you. And let's discuss those attachments. The first one is the ball head attachment. This one's the most commonly used one. It's good for big muscle groups like the quads, the chest, the biceps, the triceps, the glutes. The next one we have here is the air cushion. This one's got a little give to it, so you can go over sensitive areas, bony areas. If it's really sore or tender, you can start and warm up with this one. Next one is the bullet head, and this one is the most intense one. It's used for trigger points, smaller muscles in the wrist, bottom of your foot, for plantar fasciitis. Next we've got my least favorite one, which is this one. It's flathead, smooth, just slides everywhere. Can't really get, if you're really sore and you just want a general lovey-dovey massage, that's the one for you. And the last attachment is the U-shaped one. This one is used for your shoulder, on your spine, the back of the neck. I recommend to use this one with a partner or have your therapist use it because this one's really difficult to get to, but I'll show you and demonstrate that later. All right? Any questions so far? Drop a comment. Next, let's demonstrate how to use it. Remember, don't always go straight into the most powerful part. Don't go into using massage gun right after a nap or prolonged activity, sitting down, doing something. Make sure you are properly warmed up is what I'm saying. All right, how to attach the attachments to the unit. This is the unit, this is the attachment. You place the attachment into the unit, push in until it sticks. It's not gonna pull out. Next, you're gonna push the power button on the back and hold until it turns on. There we go. I'm not gonna keep it on during this treatment because it's gonna make me sound like I'm talking to a fan, but at some points I will turn it on. All right, so let's get it started. So let's start with the quads. Ooh, I've got sore quads. I did squats yesterday. What am I gonna do? I'm gonna turn this on to the first level and I'm gonna come perpendicular to the muscle belly. Start at the muscle belly. Try not to go straight to the joints where you feel most of your soreness or your pain. You're supposed to go to the muscle belly, warm it up, feel that you got the most cushion there. So why start at where you have the least amount of cushion and suffer? Start here. It's supposed to be a massage. It's recovery, okay? So you start in the muscle belly, work your way towards the extremities, towards the tendons where it's less muscular, move in, come in at a slight angle, perpendicular, parallel to the tendon, move in that motion. Let's give another example of my calf. Start there. Let's turn it on for this one. How about that? Starting at the muscle belly, ooh, that feels good. So starting at the muscle belly here, perpendicular to the muscle, going down, less intense, coming slightly in a parallel to the tendons that are coming down here, and it feels nice and smooth. All right, hold that for 30 seconds to 2 minutes. I mean, whatever's comfortable. Make sure that you're not digging in too deep and having the whole foot. You're gonna go onto the bone, you can bruise the bone. You're gonna cause bruises. This is not a very simple thing. Now I'm increasing the intensity of the oscillations and I'm digging in a little deeper into the soleus. And I'm not on the bone, I'm on the muscle belly. And as I'm coming down on my leg, I'm moving parallel to it at a less intense angle. And coming down. Perfect. That is the ball head. Ooh. That's off. Let's switch to the air cushion. This one again is for sensitive areas, sore muscles. This is really good for tennis elbow, lateral epicondylitis, Turn it on, start it gently, starting at the muscle belly, and then moving up towards that bone, lateral epicondylitis. Nice, gentle, easy. And then I can push in a little harder. I can feel that on the bone. That's too much. Gently over. I'm barely holding on to it. That's still doing enough mobility to it. Then we're coming back to the muscle belly. You got something in your wrist tendon. Also good for carpal tunnel syndrome, just to relax those muscles that are tight and always engaged in your forearm. Let's turn that off. It's freaking me out. My fat's jiggling. Again, struggling. Next, we got the bullet. This one's for trigger points. So if you got a certain spot in your quad, a certain spot in your wrist, some in your elbow, or your tricep you want to work out, this is the one to do. I always recommend going at a very low level throughout the whole time. Unless you're going deep into the quads, that's when you need to increase. You can always adjust with the intensity of how hard you push before you start to the next level. All you have to do is push that a couple more times. You see the lights go up a little bit more. And this is at the max peak. Ooh. And then off. And then this is the lowest. There we go. So that's the bullet. Now on to my least favorite. Attachment head. I just don't like it because it slips, especially if you're clothed. Really doesn't do much. It's got wide, it catches on clothes, catches on body hair. Ooh, but it's really good at making this sound. Luke, I am your father. So that's a good one. Nice general soreness. Get into those muscle belly near the pec. Get in there. I guess this is good for your lats too. Get it back in there because it's not very pointy and you can't roll off. Not too bad. And then the last one is the U shape. Ta-da! Same thing, insert, locked in. You can do it this way or this way. Obviously this one I recommend to do with a partner. If you want a video with this one, make sure to comment below or email me at drnaderamer@gmail.com. So an example of this one, if you have a shoulder tenderness, you want to go over that bone here, you want to get two trigger points at the same time. This is another good one. Come right here, come up and down. But also, let me demonstrate how hard and difficult position to hold this in is here. Look at that. You can easily slip off the side and get onto the bone and hurt yourself. It's uncomfortable. So I'd recommend using a partner or waiting to use or using your physical therapist to use it. Okay? Thanks for watching. I know this is one of my longer videos, but I had a good time. Let me know how you like it. Comment below. And don't forget to book an appointment at dnaphysicaltherapy.com. Thanks.